Hey guys, it's Dr. Baird here. Today we're going to talk about the 3 root causes of knee pain that are most commonly overlooked by your doctor. So what we do here at the clinic is we help people keep active, strong, doing what they love, even when nothing else has worked. And it's not because we have some magic therapy that's going to fix you, but what we do is we take a look at these root causes and fix them. And so get you back to doing what you love, even when the traditional route hasn't worked. So again, I can tell you if you have knee pain and gone to your doctor, this is kind of the traditional route that you're gonna go to. First, they're gonna tell you to rest it. Obviously, your knee pain's gonna feel better when you rest it because you're not using it, but the minute you get back to that activity, the pain is gonna come back because you haven't fixed any underlying issues. Next, they're gonna say, well, you need to start taking pain pills, which again is just another way to mask symptoms without really fixing anything. And when that doesn't work, they're gonna say, well, let's try a steroid injection, which again, they're gonna shoot a steroid right into your knee. Of course, your knee is gonna feel better because they're basically just numbing that area. But the minute it wears off, the pain's gonna come back and you're no closer to keeping active, feeling strong, feeling confident. And so then they're gonna say, well, hey, nothing else has worked. Your only option here is surgery. And then they're gonna recommend surgery. And so that's what we want to focus on, are the 3 root causes that often get left out by doctors, that if you fix these things, you don't need pills, you don't need injections, you don't need surgery. So very first one is going to be what we call movement patterns. And when I say movement patterns is how we actually move, how we coordinate movements to do basic tasks like sitting, standing, walking upstairs, bending over, lifting something up off the ground. If there's problems in the way we move, that's going to cause more force at our knees, which over time, again, this is a key thing to keep in mind, it's over time, it doesn't just happen all of a sudden. It's going to lead to more impact at the knee. Over time, that's going to cause knee pain. So easiest example would be bending forward. Do a quick example here. So 2 ways to bend forward if I'm reaching something, working over the counter, is I can bend, unlock at my knees, like that, or unlock at my hips. What happens if I unlock at my knees? Well, first, there's a lot more pull and tension. I can feel it right now going over the front of my knees. Also, my center of gravity isn't over my knees, so it's just a weird force on your knees, which, again, is something over time is going to cause knee pain. So it has to be corrected. If you're not moving right, you can get as many therapies, massages, chiropractic adjustments as you want, but until you correct that, the pain is just going to come back. The next one is mobility. So when I say mobility, what I'm talking about is how much movement does your body actually have? So the knee is directly impacted by the joints above and below, and if you don't have proper mobilities in your hips and your ankles, again, it's going to lead to more impact at your knee. In your ankles, it's kind of direct. Again, if you have stiff ankles, with each step you take, instead of being able to kind of smoothly absorb those forces of the ground, well, you're getting a nice high impact there, which gets transferred up to the knee, which again, over time, is going to lead to pain. You can take as many pain pills as you want, get as many injections as you want, but until that gets corrected, the pain is always going to come back. And the very last one is strength. So root cause of knee pain that most commonly gets overlooked, this is probably number 1 really, is strength. Your body has to be strong enough to support the activities that you want. The problem as we get older is we start to lose muscle mass. I think it's between the ages of like 24 and 50, you start losing 5% of your muscle mass. After the age of 50, you lose 10% of your muscle mass per decade. So what that means is if you're not actively building strength, you're passively losing it. And this is going to lead to more impact at your knee, which over time is going to cause pain. And so again, it's one of the things, if you don't correct the underlying strength issue, you can get as many adjustments, massages, injections, pills as you want, but the pain is always going to come back. So what do we need to do to solve knee pain even when nothing else has worked? We got to improve how you move, we got to improve how much movement you actually have, and we have to improve your strength. So if you have questions, feel free to reach out. But those are the 3 root causes of knee pain that are commonly overlooked by your doctor.